I don't think the Republicans are going to be in a real strong position to argue fiscal responsibility when they've added $4 or $5 trillion worth of national debt. I am happy to have that argument. If John McCain, for example, is the nominee, I respect that John McCain, in the first 2 rounds of Bush tax cuts, said it is irresponsible that we have never before cut taxes at the same time as we were going into war. And somewhere along the line, the Straight Talk Express lost some wheels, and now he is in favor of extending Bush tax cuts that went to some of the wealthiest Americans who don't need them, and we're not even asking for them. So I've already said a sizable portion of my health care plan will be paid for because we emphasize savings. We invest in prevention so that, as I said before, the chronically ill that account for 20%, or the 20% of chronically ill patients that account for 80% of the costs, that they're getting better treatment. We are actually paying for a dietitian for people to lose weight as opposed to paying for the $30,000 foot amputation. That will save us money. We can conservatively save $100 to $150 billion a year under my plan. That pays for part of it. Part of it is paid for by rolling back the Bush tax cuts on the top 1%. Now, so my plan is paid for. But one thing that I think we're going to have to do as Democrats when we go after the Republicans is the question is not tax cuts, tax hikes. The question is who are the tax cuts for, who are the tax hikes imposed upon. What we have had right now is a situation where we cut taxes for people who don't need them. Warren Buffett has said, I made $46 million last year. It was a bad year for me, but I can still afford to pay more than my secretary who has a higher tax rate than I do. That is not fair, and I want to change that. We've got $1 trillion worth of corporate tax loopholes and tax havens, and I've said I will close those, and I will give tax cuts to people making $75,000 a year or less by offsetting their payroll tax. Senior citizens making less than $50,000 a year, we want to eliminate taxes for them. So the question is, can we restore a sense of balance to our economy and make sure that those of us who are blessed and fortunate and have thrived in this economy, in this global economy, that we can afford to pay a little bit more so that that child in East Los Angeles who is in a crumbling school with teachers that are having to dig into their own pockets for school supplies, that they are having a chance at the American dream as well. I'm happy to have that argument.
Let me let Senator Clinton, your health care plan is estimated will cost $110 billion annually. You want to tax the rich to pay for that? Is that what you're saying?
Well, let me say that the way I would pay for this is to take the Bush tax cuts that are set to expire on people making more than $250,000 a year. That would raise about $55 billion, and I would put that into these subsidies for the health care tax credits so that people would be able to afford the health care that we are offering. The other $55 billion would come from the modernization and the efficiencies that I believe we can obtain. We spend more money than anybody in the world on health care, and there is no end in sight. Yet we don't get the best results. We don't have the longest lifespan. We don't have the best infant mortality rates. We could do so much better, and here are some of the ideas that I have put on the table. Number one, the Bush administration has given enormous tax giveaways to HMOs and drug companies under the Medicare Prescription Part D program, under the HMO program in Medicare. I would rein those in. They are not being earned. They do not produce the results that are supposedly being touted by the Bush administration. I would also move toward electronic medical records, something that I've worked on for nearly 5 years on a bipartisan basis, started with Newt Gingrich and Bill Frist. We passed my legislation through the Senate a year ago, didn't get it through the Republican House. Now we're going to try again in the Democratic Congress. If we had electronic medical records, according to the RAND Corporation, hardly a bastion of liberal thinking, they have said we would save $77 billion a year. That money can be put into prevention. It can be put into chronic care management. It can be put into making sure that our health care system has enough access so that if you are in a rural community, somewhere in California or somewhere in Tennessee or somewhere in Georgia, you'll have access to health care. If you're in an inner city area and you see your hospital, like the Drew Medical Center, closed on you, then you're going to have a place, once again, where you can get health care in the immediate area. So we can begin to be more effective and more sensible about how we cover everybody and use the money from the top-end tax cuts and from modernizing